Welcome to PG Proposal Blueprint. In this series, we are going to build a simple, practical, and strong understanding of how to create a research proposal in allied healthcare sciences. If you are a postgraduate student and a word proposal already feels heavy, confusing, or stressful, this video is for you. Let us begin with one very important point. A research proposal is not just a document you prepare because your guide asked for it. It is not just a university form. It is not just a file you submit and forget. A proposal is the thinking document behind your study. It explains what you want to study, why that topic matters, how you are planning to do the study, and whether the study is worth approving. In simple words, a proposal is your study before the study begins. Many students think proposal writing starts with typing. Actually, proposal writing starts with thinking. The document is only the visible part. The real work is the clarity behind it. So, if your proposal is weak, the problem is often not language. The problem is that the thinking is still unclear. If the thinking becomes clear, the proposal becomes much easier to write, explain, defend, and improve. That is why this first video is important. Before we go into the title, aim, objectives, literature search, methods, sample size, ethics, or AI use, you must first understand what a proposal really is. A proposal is not a decoration. It is not a ritual. It is not a burden created by the university just to trouble students. It is a plan. And every good plan answers a few simple questions. What exactly are you studying? Why does this problem deserve attention? Who or what will be studied? How will the study be carried out? And is the study ethical, practical, and worth doing? When you understand that, proposal writing becomes more meaningful and less frightening. Now, let us look at another point that many students miss. Your proposal is not read only by you. First, your guide reads it. Your guide wants to know whether your topic is clear, whether your study is feasible, and whether you actually understand what you are planning to do. Second, your department may look at it. Sometimes there is an internal review, discussion, or correction before things move forward. Third, the ethics committee may read it, especially if your study involves human participants, patient-related information, interventions, or sensitive data. For them, the proposal is not just an academic file, it is a safety and responsibility document. In some situations, the university or another academic review body may also look at the proposal. So when you write a proposal, you are not writing only for marks. You are writing for decision making. That is why clarity matters so much. Now, let us clear up one very common confusion. A topic is not the same as a proposal. For example, a student may say, my topic is sleep quality in physiotherapy students. That is a topic. It is still broad. It is only a direction. But a proposal is much more than that. A proposal takes that broad topic and turns it into a clear, structured plan. It tells us the exact title, aim, objectives, population, tools, method, analysis plan, and ethical considerations. So, a topic is like saying where you want to go. A proposal is the map that shows the route. This is why many students feel stuck. They think that having a topic means they are almost done. Actually, having a topic means the work has just started. The journey from topic to proposal is the real academic work. And that is exactly what this series will help you do, step by step in simple language. So, what should a good proposal do? A good proposal should clearly answer 5 basic questions. First, what exactly are you going to study? Not in a vague way, but in a focused and researchable way. Second, why does it matter? Why is this problem important in your field, your students, your patients, your hospital, or your community? Third, who or what will be studied? This includes the participant group, the setting, and the study's boundaries. Fourth, how will the study be done? This is where design, tools, procedure, variables, and analysis begin to enter. And fifth, is the study ethical and practical? Can it actually be done with the available time, setting, permissions, and resources? And can it be done responsibly? If a proposal answers these 5 questions well, it becomes much stronger. Not necessarily perfect, but strong enough to discuss, improve, and move forward. If it does not answer these questions, then even beautiful language will not save it. That is another important lesson I want you to remember from this series. Good writing is useful, but clear thinking is more important than polished wording. A proposal should not only sound academic, it should make academic sense. In the next video, we will move on to a very important topic, especially now that many students are already using AI tools for research. The next video will be, before you use AI for your proposal, do these 5 things. That video will help you get started in the correct order, because AI should come after thinking, not before. So for now, remember this simple sentence. A research proposal is not just a document. It is the plan, logic, and responsibility behind your study. Once that is clear, the rest becomes much easier. Let us continue in the next video. Welcome back to PG Proposal Blueprint. In the first video, we understood what a research proposal really is. Now we are going to talk about something extremely important, especially at this time when many students already use AI tools before they even begin to think properly about their proposals. This video is not against AI. The goal is not to scare you. The goal is to teach the correct order. The biggest mistake many students make is very simple. They open an AI tool first, then they ask for a topic, then they ask for objectives, then they ask for methodology, then they ask for references, and very quickly the proposal starts to look polished before the student has even understood the study's basic logic. That is the wrong order. The problem is not only that AI can make mistakes. The deeper problem is that when you begin with AI, you often skip your own thinking. And if your own thinking is weak, then even a beautifully written proposal will remain weak. So what is the correct order? The correct order is this. First observe, then think, then form your question, then read a little, and only after that should AI enter carefully as a support tool. Think of it like this. AI should not be the source of your research curiosity, it should not be the source of your original observation, and it should not be the authority that decides your study for you. Your proposal must begin with you. It may begin with something you noticed during clinical posting. It may begin with a recurring problem among students, patients, caregivers, or in laboratory work. It may begin with confusion, frustration, curiosity, or a real need you have seen in your setting. That is where research starts. If you open AI before that, you may get fast output, but you may also lose the real academic center of the work. So before you use AI for your proposal, I want you to do 5 simple things first. Number 1, write your observation. What exactly did you notice? Do not try to sound academic yet. Write it in plain language. For example, many students in my batch seem tired during clinical posting, or caregivers of children with cerebral palsy look very stressed during therapy sessions, or physiotherapy students complain of neck pain after long online sessions. This first step matters because a research topic should come from a real observation, not from a randomly generated title. Number 2, write your question in simple words. Can you explain your question without jargon? For example, is screen time affecting sleep in allied healthcare students? Or does a relaxation technique reduce caregiver stress? If you cannot explain your question simply, then your research thinking is probably still unclear. Number 3, list what you already know. What do you already know from classes, postings, reading, or experience? Maybe you already know one related scale, one possible variable, one possible outcome, or one relevant group. This step is important because it helps you start from your current understanding rather than acting as if you know nothing and the AI knows everything. Number 4, list what you do not know. This step is very powerful. Maybe you do not know whether the topic has already been studied in your setting. Maybe you do not know which tool is commonly used. Maybe you do not know whether the design should be cross-sectional or experimental. Maybe you do not know how the sample size is decided. This is the stage where gaps in your understanding become visible. And that is good. Because once you can see the gap, you can decide how to fill it properly. Number 5, decide where AI can help. This should come last, not first. So, where can AI help once some clarity has already begun? AI can help you understand a concept in simpler words. It can help you organize your ideas. It can help improve wording once the content is already yours. It can help turn rough notes into a cleaner structure. It can help create a checklist so you do not forget important sections. These are useful roles, but there are also areas where AI should not lead your proposal. It should not decide your research gap for you. A gap must be found through actual reading and comparison, not simply claimed by a tool. It should not generate references that you paste without verification. A polished citation is not the same as a real paper. It should not design your methodology before you understand your own question. Methodology is not decoration, it is design logic. And it should not confidently give you a sample size decision unless the inputs are real, justified, and carefully checked. So the message of this video is very simple. Do not use AI as the starting brain of your proposal. Use it later, after you have your own observation, your own basic question, your own known and unknown points, and your own developing clarity. This way, AI becomes a support system, not a substitute for research thinking. And that is the right relationship. In the next video, we will move on to the next important step, choosing a good and feasible topic. That is where many proposals become either strong or weak very early. So remember this one line from today. First think, then the question, then read, then use AI carefully. That one order can save you from many mistakes later. Let us continue in the next video. Welcome back to PG Proposal Blueprint. In the last video, we discussed what to do before using AI for your proposal. Now we come to one of the most important early decisions in your whole research journey, choosing the topic. Many students think topic selection is a small step. Actually, it is one of the biggest steps. A weak topic creates confusion later in title writing, objectives, literature search, methodology, sample size, and even ethics. A strong topic makes all those next steps easier. So what usually goes wrong? Many students choose a very broad topic. For example, sleep in students, stress in healthcare workers, awareness of health issues, or the effect of exercise on health. These sound academic, but they are still too broad. They do not yet tell us exactly what is being studied, in whom, and in what setting. Some students pick a topic only because it sounds modern or trendy. Others copy a title from another paper or from a senior's dissertation without asking whether it fits their own department, time, access, tools, or guide support. This is where the trouble starts. A topic is not good just because it sounds serious. It is not good just because someone else studied something similar. And it is not good just because AI gave you a polished title. A good topic has to work in real life. That means you must think not only about interest, but also about access, practicality, measurements, time, supervision, and ethics. Topic selection is not only a creative game, it is a research decision. So, in this video, I want to give you a simple way to choose a topic more intelligently without making the process feel complicated. A good topic usually passes 4 filters. First, it should interest you. This matters because you will spend weeks or months with this study. If you feel no connection at all, you will lose energy very quickly. Second, it should be relevant to your field. If you are in allied health sciences, the topic should clearly connect to your academic or clinical area. Your proposal should not feel disconnected from your training. Third, it should be feasible in your actual setting. This is where many students fail. A topic may sound excellent, but can you actually access the participants? Can you collect the data? Do you have the required tool, time, permission, and supervision? If not, then the topic is not yet practical for you. Fourth, it should be clear enough to study properly. A topic like student stress is too broad, but when you refine it to something like screen time and sleep quality among allied healthcare students during clinical postings, it becomes much better. Why is that better? Because now the group is clearer, the setting is clearer, the variables are becoming clearer, and the study starts moving from vague interest to a researchable direction. This is the shift you must learn. You do not need the perfect final title at this stage, but you do need to move from a general area to a more focused, meaningful, and doable research question. That is why broad ideas are not wrong. They are just early stage ideas. Your job is to refine them, not worship them. So, when a student says, I want to study sleep in students, I would say, good, that is your starting point. Now let us sharpen it. Which students? What aspect of sleep? Why this group? What may be affecting it? What can you realistically measure? That is how a topic becomes stronger. Before you freeze your topic, ask yourself a few practical questions. Do I have access to the participants I want to study? For example, if you want to study caregivers, older adults, or patients with a specific condition, can you actually reach them in your setting? Can I measure the main variable properly? If your topic depends on stress, sleep quality, balance, awareness, or pain, do you know how these will be measured? A topic becomes weak if the main idea sounds interesting, but the measurement remains unclear. Is this possible in my time frame? PG students often have limited months, multiple academic responsibilities, and practical constraints. A topic that needs a long follow-up, difficult recruitment, or advanced tools may not be wise for a first proposal. Will my guide and setting support it? Even a good topic becomes difficult without departmental support, access, or practical guidance. And finally, is it ethically manageable? Some topics sound strong, but they involve vulnerable populations, sensitive data, or procedures that may complicate approval. That does not mean such topics are bad. It means they need more maturity and more planning. So the main lesson of this video is simple. Do not choose a topic only because it sounds impressive. Choose a topic that is interesting, relevant, feasible, and clear enough to become a real study. In the next video, we will take the next major step. Once you have a topic direction, how do you turn it into a title, aim, objectives, and a hypothesis? That is the stage where many students become confused, and we will make it simple. So remember this line. A broad idea may attract you, but a feasible topic is what moves your proposal forward. Let us continue in the next video. Welcome back to PG Proposal Blueprint. In the previous video, we discussed how to choose a good and feasible topic. Once the topic direction becomes clearer, students usually reach the next confusing stage. The title, aim, objectives, and hypothesis. These four are very commonly mixed up. Sometimes students write an aim that sounds like a title. Sometimes they write objectives that are actually broad aims. Sometimes they write a hypothesis without even knowing whether the study design really needs one. And sometimes all four parts are present, but they do not logically connect. So, in this video, let us keep it simple. The first thing to understand is that these four parts are connected in a sequence. The title comes first, then aim, then the objectives. Then the hypothesis is appropriate for the study. You can think of it like a chain. The title tells us what the study is about. The aim tells us the main purpose. The objectives break down that aim into specific workable parts. The hypothesis tells us what relationship or difference you expect to find, but only when such a statement is suitable. So, these are not four separate decorations in the proposal. There are four parts of the same logic. If one part is weak, the next part also becomes weak. For example, if the title is vague, the aim tends to be broad. If the aim is broad, the objectives become unclear. And if the objectives are unclear, the whole methodology later becomes confusing because you do not know exactly what should be measured. That is why this section matters so much. A strong proposal does not begin with complicated language. It begins with correct logic. And once the logic is right, the wording becomes much easier. So let us define these one by one. First, the title. The title tells the reader what exactly is being studied. It should give a clear sense of the topic, the main variables or issue, and often the population or setting. It does not need to be very long, but it should not be vague. Second, the aim. The aim is the study's main purpose. Usually, it is one broad statement. It answers the question, what is this study trying to do overall? For example, if the title is about screen time and sleep quality in allied healthcare students, the aim may be to assess the association between screen time and sleep quality in that group. Third, the objectives. Objectives are more specific. They break the aim into smaller academic tasks. This is where many students make mistakes. Objectives should not be too broad and should not be impossible to measure. A useful way to think about this is, one objective should point to something specific that the study will assess, compare, describe, or examine. In other words, objectives should lay the groundwork for your methods and analysis. Fourth, the hypothesis. A hypothesis is not compulsory in every proposal. Some studies use it, some do not. But when used, it usually states the expected relationship, difference, or effect. It is a more focused expectation than the aim. So the most important lesson is this. The title is not the aim. An aim is not an objective. Objectives are not hypotheses. But they should still fit together like parts of one structure. When that happens, the reader feels that the proposal is moving in a clear direction. Let us take one simple example. Suppose your topic direction is screen time and sleep quality in allied healthcare students. Your aim could be to assess the association between screen time and sleep quality in allied healthcare students. That is the main purpose. Now the objectives can become more specific. For example, to measure daily screen time, to assess sleep quality, and to examine the relationship between the two. Now the proposal starts making sense. Why? Because each objective is connected to something that can later be measured. Screen time can be measured. Sleep quality can be assessed using an appropriate tool, and the relationship between the two can be analyzed. If you want to write a hypothesis, a simple version could be higher screen time is associated with poorer sleep quality. That is a testable expectation. Now, let us also understand a common mistake. A student may write a vague title, an aim that is too broad, and objectives that sound academic but cannot be measured. For example, to understand sleep, to know the effect of lifestyle, or to evaluate student well-being without clear variables, group, or method direction. These may sound nice, but they do not help the proposal move forward. So, as you write this section, always ask, is the title clear? Does the aim express the main purpose? Do the objectives break the aim into measurable parts? And if I am using a hypothesis, is it appropriate and testable? If you answer yes to these 4 questions, you are already building a stronger proposal. In the next video, we will go one step deeper. We will discuss how to find a real research gap, because many students can write a topic and even an aim, but they still struggle to explain why the study is needed. That is what we will solve next. So remember this line. A good proposal does not just sound academic. Its title, aim, objectives, and hypothesis must all point in the same direction. Let us continue in the next video. Welcome back to PG Proposal Blueprint. In the previous video, we discussed the title, aim, objectives, and hypothesis. Now we move to one of the most misunderstood parts of proposal writing, the research gap. Students often hear this phrase very early. They are told that every study must fill a gap. But many students are never properly taught what a gap actually is, how to identify one, and how to write it honestly. So what happens? A very common pattern is this. A student asks an AI tool, is there a research gap in this topic? The tool gives a confident answer. Then the student writes something like, there is a huge gap in the literature, or this study will fill the gap. But the student has not actually shown where that gap came from. That is the problem. A research gap is not something that becomes true because an AI tool says yes. And it is not something that becomes academic just because the words sound serious. A real gap has to come from reading, comparing, and thinking. In your planning materials, this exact issue came up strongly. Students often treat AI confirmation as proof of novelty, even though a true gap must be identified through actual literature mapping and critical reading. So, this video is here to correct that early. The main idea is simple. A gap must be found, not just claimed. If you understand that one sentence properly, your rationale becomes much stronger and your proposal immediately becomes more believable. So, what is a real research gap? A real research gap appears when reading shows that something is missing, limited, weak, inconsistent, or still unclear. For example, a topic may have been studied in general student populations but not in allied healthcare students. Maybe it has been studied in another country but not in your educational or clinical setting. Maybe the outcome has been measured with different tools across studies, making the findings difficult to compare. Maybe only descriptive work exists, but no comparative or analytical studies have been conducted. Or maybe studies exist, but they still leave an important practical question unanswered. That is where a real gap starts to appear. So, how do you find one without becoming lost? Use a simple method. First, read a few relevant studies, not 50 at the beginning, just enough to understand the field. Second, compare the studies, compare the population, setting, variables, tools, and type of analysis. Third, notice what seems missing, weak, narrow, repetitive, or uncertain. And fourth, write the gap in your own words. That last step matters a lot. A student who merely copies "there is a limited literature" from elsewhere does not actually understand the gap. But if you can explain it in your own words, then your thinking is becoming real. Your notes also warn that the tutorial must not become tool first. It should teach the research thinking first, then later show where AI may assist. That applies very strongly here. A gap is first a reading and reasoning task, not a chatbot task. Let us take one simple example. Suppose your topic direction is screen time and sleep quality in allied healthcare students. A weak gap statement would be something like, "There is a huge gap in the literature." This sounds formal, but it tells the reader almost nothing. What gap? In which population? In which setting? Compared with what? How do you know? Now compare that with a better version. You might say, although sleep and screen use have been studied in student populations, fewer studies have focused specifically on allied healthcare students during clinical postings, where schedules and academic demands may differ. Now the statement becomes stronger. Why? Because it is more specific. It gives the reader a reason. It points to a particular population and context. It does not just announce novelty. It explains why this version of the question still deserves attention. That is what you want. So, as you work on your proposal, do not try to manufacture novelty using vague sentences. And do not let AI tell you that your topic is new without checking the literature yourself. Instead, read a few relevant studies, compare them honestly, and then state the gap carefully. Also, remember one more thing. Not every study needs to claim a dramatic gap. Sometimes your study is useful because it examines the question in a different population, educational context, or clinical setting, or uses a clearer measurement approach. That is perfectly valid. In the next video, we will move on to the practical side of this process, the literature search for proposal writing. That is the natural next step, because once you know that the gap must be found in the literature, the next question becomes, how do I search the literature properly? So remember this line from today. A research gap is not an academic sentence. It is a conclusion you reach after reading and comparing the literature. Let us continue in the next video. Welcome back to PG Proposal Blueprint. In the previous video, we discussed how to find a real research gap. Now, the next natural question is, how do you search the literature properly? For many students, the literature search becomes stressful very quickly. They open a database or Google Scholar, type in a broad query, get hundreds or thousands of results, download many PDFs, and then feel confused rather than informed. That is the wrong way to approach it. Literature search is not about collecting as many papers as possible. It is about finding the right papers for the right purpose. At the proposal stage, your goal is not to become the world expert on the topic in one day. Your goal is to understand enough of the existing literature to do a few important things well. You want to understand what has already been studied. You want to see how similar topics were framed. You want to identify common variables, tools, and populations. You want to see where your topic fits. And you want enough evidence to support your rationale and your proposal decisions. So, the literature search should be purposeful. A common mistake is searching randomly, downloading too many papers, reading nothing carefully, and then replacing real reading with an AI summary. That feels fast, but it creates a shallow understanding. An AI tool may help you orient yourself. It may help you simplify a concept, but it cannot properly replace the academic value of reading titles, abstracts, and selected full papers. So in this video, let us make literature search practical and less frightening. The key idea is simple. Do not search widely first. Search intelligently first. So where should you search first? For many healthcare and allied healthcare topics, PubMed is one of the best starting points. It is widely used and helps you find biomedical and health-related literature. Google Scholar can also help, especially when you want a broader academic search or when you are trying to locate full texts, similar papers, or citation trails. Another useful source is the reference list of a good paper. Once you find one relevant paper, its references may lead you to earlier important work. Tools like Elicit or Perplexity can help you orient yourself early. They may help you understand terminology or identify possible directions, but they should not become your final proof of what the literature says. They are support tools, not your evidence base. Now, let us simplify the actual search process. Start with your key concepts. If your topic is screen time and sleep quality in allied healthcare students, your key concepts may be screen time, sleep quality, and students. Then think of 2 to 4 search words for each concept. For screen time, maybe smartphone use, digital media, and mobile use. For sleep quality, maybe sleep disturbance or sleep pattern. For students, maybe university students or health students. Next, combine the words in different ways and search them. Then read the titles and abstracts first. This is very important. Do not open every paper fully at the beginning. First ask, is this paper really close to my topic? Is the population relevant? Is the outcome relevant? Is the setting useful? If yes, save it. If no, move forward. This filtering habit saves a lot of time. Let us take one simple example. Suppose your topic direction is screen time and sleep quality in allied healthcare students. Your first job is not to search the full sentence exactly as it is. Your first job is to break it into key concepts. Here, the key concepts are screen time, sleep quality, and students. Now you can create combinations such as screen time and sleep quality in students, smartphone use and sleep and health among students, or digital media and sleep quality in university students. These combinations will not all give equally useful results, and that is normal. A literature search is often an iterative process. You try, observe, refine, and search again. As you review titles and abstracts, ask yourself a few simple questions. Does this paper actually relate to my main variables? Is the population similar enough to be useful? Does it help me understand the background, the tools, or the gap? If yes, save it. If not, do not keep everything just because it appeared in the search. That is another major lesson in proposal work. A useful literature search is not only about finding papers, it is also about rejecting papers that are not truly helping your proposal. So remember this line: do not collect papers blindly. Search, filter, and think. In the next video, we will move on to the next stage, writing the rationale and reviewing the literature. That is where students often struggle to turn papers into academic writing. But once your search process improves, that writing step becomes much easier. Let us continue in the next video. Welcome back to PG Proposal Blueprint. In the previous video, we discussed the literature search for proposal writing. Now comes the next challenge. Once you have found some relevant papers, how do you actually write the rationale and review of the literature? This is the stage where many students struggle. Why? Because they often think this section means one simple thing: collect papers and summarize them one by one. So the writing becomes something like this. Paper 1 says this, paper 2 says that, paper 3 says something else. And after a few paragraphs, the reader still does not know why your own study is needed. That is the problem. A rationale is not a paper list. A review of literature in a proposal is not meant to show that you can copy many findings into one section. Its real purpose is to help the reader understand the problem, the current knowledge, the unclear area, and why your study should be conducted. So this section is not just about information. It is about direction. If the section is weak, the proposal feels unfocused. Even if the topic sounds good, the reader may still ask, why this study? Why this group? Why now? Why in this setting? That is exactly what the rationale must answer. So in this video, let us make it simple and practical. We will not try to write a giant thesis style review. We will only understand how to build a meaningful rationale and a useful literature review for a proposal. So what should this section actually do? First, it should introduce the problem. The reader should quickly understand what issue you are addressing. For example, poor sleep quality, caregiver stress, hand hygiene compliance, or student burnout. Second, it should show what is already known. This means you use the literature to establish that the topic is real, relevant, and already studied to some extent. You are showing that your study is grounded in evidence, not random curiosity. Third, it should show what is still unclear. This is where the literature helps you move toward your research gap. Maybe the topic has been studied in a general population, but not in your setting. Maybe the tool used across studies is inconsistent. Maybe the available evidence is limited in your target group. Fourth, the section should lead naturally to your study. This is very important. By the end of the rationale, the reader should feel that your proposal is the next logical step. A simple writing structure can help. Start with the problem, then summarize the most relevant evidence, not every paper you found. Then narrow the discussion to your population, setting, or specific angle. And finally, end with the reason your study is needed. That is a much better structure than writing disconnected summaries. Also, remember this: relevance is more important than quantity. 10 well-used studies are often more helpful than 30 poorly summarized ones. Let us look at one simple example. Suppose your topic is screen time and sleep quality in allied healthcare students. A weak version of the rationale may sound like this. Many studies have been done. Sleep is important. Screen time is common. Students use phones a lot. This is not completely wrong, but it is weak. It sounds general, repetitive, and unsupported. It does not build an argument. Now compare that with a better version. You might write that sleep quality is an important health and academic concern in student populations. Existing studies suggest that screen exposure may affect sleep, but fewer studies focus specifically on allied healthcare students during clinical posting, where schedules and academic pressures may differ. This makes the topic worth examining in this setting. Why is this stronger? It introduces the problem, mentions what is already known, narrows to your specific group, and ends with a clear reason for your study. That is exactly what you want your rationale to do. So as you write, ask yourself, am I just listing papers, or am I building a logical path toward my study? That question can improve this whole section. And remember, a proposal review of literature is not expected to be endless. It should be selective, relevant, and connected to the purpose of your study. In the next video, we will move on to one of the most important sections of the proposal, building the methodology section. That is where your study starts becoming concrete. So remember this line from today. Do not write a paper list. Build a clear argument that leads to your study. Let us continue in the next video. Welcome back to PG Proposal Blueprint. In the previous video, we discussed how to write the rationale and the literature review. Now we come to one of the most important parts of the whole proposal, the methodology section. This is the section where your study stops being just an idea and becomes a real plan. That is why methodology matters so much. Many students become anxious here because the word methodology sounds technical and heavy. So they try to solve that problem by writing complicated language. But that is exactly where many proposals become weak. Methodology is not about sounding scientific. Methodology is about clearly showing how the study will actually be conducted. A common wrong approach is this. The student writes a design using impressive words, but it remains vague. The participants are not clearly defined. The variables are not explained properly. The tools are not introduced well. And the procedure is so general that the reader still cannot imagine how the study will actually happen. That is the problem. If your guide, department, or ethics committee reads the methodology and still has to ask basic questions like who exactly you are studying, what exactly you are measuring, or how exactly the data will be collected, then the methodology is still weak. In this video, I want to keep this section simple. You do not need to memorize a giant textbook chapter right now. You only need to understand that methodology is the study plan. And a good study plan should clearly answer a few very practical questions. So what usually belongs in a proposal methodology section? First, the study design. This tells us what kind of study you are planning. Is it cross-sectional, experimental, comparative, observational, or something similar? The design should fit your question. It should not be selected only because it sounds advanced. Second, the study setting. Where will this study happen? In a college, hospital, clinic, laboratory, or community setting. The setting matters because it affects feasibility, access, and interpretation. Third, the participants. Who exactly will be studied? This should be clear. Not just students, but which students? Not just caregivers, but caregivers of whom? The more appropriate the clarity, the stronger the methodology becomes. Fourth, variables and tools. What are the main things you are studying? How will they be measured? If you are studying stress, sleep quality, pain, or awareness, what tool or method will you use to assess that? Fifth, procedure. How will the study actually move from start to finish? What will participants do? What will the researcher do? In what order will data be collected? And sixth, a basic analysis plan. Not the full advanced statistics yet, but at least a simple sense of how the collected data will be examined. A useful way to think about methodology is this simple logic. Who will be studied? What will be measured? How will it be measured? When and where will it happen? And how will the data be examined? If your methodology answers these questions clearly, you are already moving in the right direction. Let us take one simple example. Suppose your topic is screen time and sleep quality in allied healthcare students. A basic methodology direction could look like this. The design may be cross-sectional. The participants may be allied healthcare students during clinical posting. The variables may be daily screen time and sleep quality. The tools may include a structured questionnaire and a sleep quality assessment scale. And the procedure may involve collecting responses, recording the relevant variables, and analyzing the relationship between the two main variables. Now notice something important. This methodology is not strong because it uses complicated language. It is stronger because it is becoming specific. That is the lesson. Specificity is more valuable than decoration. Students often think methodology looks weak unless it sounds complex. Actually, many methodologies appear weak because they try to sound complex without showing the study's real logic. So as you build this section, ask yourself, can the reader understand who my participants are? Can the reader understand my main variables? Can the reader see how I plan to measure them? Can the reader imagine the procedure? And does the study design actually fit my research question? If the answer is yes, your methodology is becoming much stronger. In the next video, we will move into another major area where many students become confused: sample size and statistical planning. That topic often feels scary, but we will make it much simpler. So remember this line from today: weak methods create weak proposals. Be specific, not decorative. Let us continue in the next video. Welcome back to PG Proposal Blueprint. In the previous video, we discussed how to build the methodology section. Now we move to another part that many students fear very early: sample size and statistical planning. For many PG students, this part feels scary because it sounds mathematical, technical, and difficult. So what do? They postpone it, avoid it, or ask AI for a quick answer. That is where many problems begin. A common wrong approach is to ask an AI tool for a sample size, copy a formula without understanding what the numbers mean, add 2 or 3 random test names into the proposal, and assume that statistics can be fixed later after data collection. That is not a good approach. Sample size and statistical planning are not decorations that you add to make the methodology look complete. They are part of the study's logic. If the sample is too small, the study may not answer the question properly. If the main analysis is unclear, the collected data may not align well with the research objective. And if the test names are added randomly, the proposal may look academic but still remain weak. So in this video, our aim is not to turn you into a statistician. Our aim is much simpler. You should understand what sample size depends on, what basic statistics planning means at the proposal stage, and what you should be able to discuss with your guide or a statistician before the study begins. That is enough for now. And once that basic logic is clear, the fear around this section becomes much smaller. So, what does sample size depend on? It depends on several things. First, it depends on the study design. A cross-sectional study, an experimental study, and a comparison study may not use the same logic for sample estimation. Second, it depends on the main outcome or variable. What exactly are you trying to estimate, compare, or relate? Third, it depends on the expected difference or relationship. If a study is trying to detect a very small effect, the sample requirement may be different from a study expecting a larger difference. Fourth, it depends on the level of precision or confidence needed. And fifth, it depends on feasibility. Even when the ideal sample looks good on paper, real-life access, time, permissions, and resources still matter. So sample size is not just a number, it is a decision built from design logic plus practical reality. Now let us talk about basic statistics planning. At proposal stage, you do not need to know every formula or every advanced method, but you should start asking the right questions. What type of data will you collect? Are you mainly describing something, comparing groups, or examining a relationship? What is the main outcome of the study? And what type of test may fit that kind of question? That is the right beginning. Notice something important here. Statistical planning begins before data collection, not after. If you collect data without basic planning, you may later discover that the data structure does not properly match the question. Let us take one simple example. Suppose your topic is screen time and sleep quality in allied healthcare students. Your main question may be, is higher screen time associated with poorer sleep quality? Now at this stage, your proposal does not need to present a full advanced statistical report, but it should show that you are thinking properly. You may state that a suitable sample will be estimated with guidance or statistical support. You may explain that data on screen time and sleep quality will be collected. You may describe the sample first using basic descriptive methods, and then you may examine the relationship between the two variables using an appropriate analysis approach. That is already much better than writing random formulas or dropping test names without understanding them. So, the key lesson from this video is simple. Do not treat sample size and statistics as something to be copied. Treat them as part of study planning. Ask what kind of study you are doing, what your main question is, what your main variable or outcome is, and what type of analysis may logically fit that question. If needed, seek help from a guide, a statistician, or a proper sample size tool. That is absolutely normal. In fact, asking for proper help is much better than pretending to be confident and adding incorrect information. In the next video, we will move to another very important section: ethics, IEC, consent, and practical feasibility. That section matters because even a methodologically good study must still be ethical and manageable in real life. So remember this line from today: do not treat statistics as decoration. Plan it early. Let us continue in the next video. Welcome back to PG Proposal Blueprint. In the previous video, we discussed sample size and statistical planning. Now we move to something equally important: ethics, IEC, consent, and practical feasibility. This part matters because even a well-written topic with a good rationale and a decent methodology is still not enough if the study is ethically weak or practically unrealistic. Many students treat ethics as a short paragraph added near the end. They write one or two formal sentences about consent and confidentiality and feel the section is complete. That is a very common mistake. Ethics is not a decoration. Ethics is about protecting participants, respecting the dignity and privacy, reducing avoidable risks, and ensuring the study is proposed responsibly. And IEC, or the Ethics Committee, should not be seen as only a signature step. The committee is not there just to approve a file. It is there to examine whether the proposed study is appropriate, safe, and responsibly planned. Your planning notes identified this clearly too. Generic or weak ethics handling, especially around consent forms, participant risk, and healthcare research realities, can delay or weaken the entire proposal. So, in this video, I want to simplify the thinking. You do not need to become an ethics expert overnight, but you do need to ask the right questions before submission. That alone can make your proposal much stronger. So, what do ethics and IEC really mean in practical terms? First, they mean participant protection. If your study involves people, the proposal must demonstrate that their rights, privacy, and safety are respected. Second, ethics means reducing avoidable risk. Some studies are very low risk, such as a questionnaire based student survey. Some studies may involve more sensitive information, more vulnerable groups, or more demanding procedures. Ethical thinking must align with the study's actual nature. Third, ethics means respecting privacy and dignity. If a participant shares information, especially personal, health related, or sensitive information, the researcher must think carefully about confidentiality and data handling. And fourth, ethics means responsible planning. A poorly planned study can itself become an ethical problem. If the sample is unrealistic, the procedure is unclear, the burden on participants is unnecessary, or the timeline is impossible, then the study is not responsibly designed. A simple approval thinking framework can help. Ask who is involved, what exactly will they be asked to do, what are the risks or discomforts, how will consent and confidentiality be handled, and can this study actually be completed in your setting? These are not advanced questions, but they are very powerful questions. If a proposal cannot answer them clearly, then it is not yet ready. Let us take one simple example. Suppose your topic is screen time and sleep quality in allied healthcare students. This is likely a low risk questionnaire based study that already tells you something useful. The ethical burden may be lower than in an interventional or patient based study, but it still needs careful handling. You still need to explain the purpose clearly to participants. You still need participation to be voluntary. You still need to keep the responses confidential. And you still need to make sure the sample is realistically accessible in your setting. That last point is important. Feasibility is closely connected to ethics. A study that looks fine on paper but cannot realistically recruit participants, collect data properly, or finish within the available time is not just impractical. It may also waste effort and participant time. So, the lesson from this video is simple. A good proposal is not only about academic writing, it is also about safety, respect, realism, and responsible planning. When you think about ethics, do not ask only, do I have a consent sentence? Ask instead, is this study fair to the participants? Is it manageable in my setting? And does the proposal show that I have thought about real world responsibility? If the answer becomes yes, your proposal is getting stronger. In the next video, we will move on to a very practical, reviewer-focused topic: what guides and reviewers notice in weak proposals. That will help you start seeing your own draft from another person's point of view. So remember this line from today: good proposals are safe and realistic, not just well written. Let us continue in the next video. Welcome back to PG Proposal Blueprint. In the previous video, we discussed ethics, IEC, consent, and practical feasibility. Now we are going to do something very useful. We will step out of the student's position for a moment and try to see the proposal through a reviewer's eyes. This is important because many students judge their own proposals primarily by how they look on the page. If the language feels formal, the sentences sound academic, and the section headings are present, they start feeling confident that the proposal is strong. But that is not how guides and reviewers read. A reviewer is not impressed only by polished English, length, or complex academic words. In fact, sometimes these things can create the opposite effect. They can make the reviewer look more carefully for weak logic hiding under formal writing. A common mistaken belief is that good English means good research thinking. Another is that more pages automatically mean stronger work. Another is that an academic tone can compensate for an unclear method or weak logic. That is not true. A weak proposal can be well written, and a stronger proposal can sometimes be written in simpler language but still feel much more trustworthy. That is why this video matters. If you learn quickly what reviewers notice, you can start checking your own draft more honestly before submission. So, what do reviewers notice quickly in weak proposals? They often notice when the topic is still broad or vague. The title may sound nice, but the actual focus is still unclear. They notice when the aim and objectives do not match. For example, the aim sounds broad, but the objectives do not really measure the same thing. They notice when the methods are unclear. If the reader still does not know exactly who is being studied, what is being measured, or how the study will be conducted, confidence starts to drop. They notice when the gap is loudly claimed, but not actually shown through the literature. And they notice when ethics and feasibility feel weak. Even a promising topic becomes doubtful if the proposal fails to demonstrate realistic access, proper planning, or participant care. Behind all these observations, the reviewer is usually asking a few simple questions. What exactly is being studied? Why is this study needed? Can this design really answer the question? Is the proposal ethical and realistic? And perhaps most importantly, does the student seem to understand the plan? Or is the proposal only written to sound academic? That last question is very important. A proposal should not only look structured, it should feel intellectually owned by the student. When that happens, the draft begins to feel much stronger. Let us think very simply. Imagine two proposal drafts. The first has an interesting topic, formal writing, and proper section headings. But the method is still vague, the objectives do not clearly match the aim, and the rationale feels general. The second may not sound overly sophisticated, but it has a clear question, a focused aim, measurable objectives, a defined method, and a realistic plan. Which one feels stronger to a reviewer? Usually the second one. Why? Because reviewers are not only reading for language, they are reading for trust. A strong proposal feels trustworthy. It gives the sense that the student understands what they want to do, why they want to do it, and how they plan to do it responsibly. So, as you revise your own proposal, ask yourself a few reviewer style questions. Is my topic still too broad? Do my aim and objectives really point in the same direction? Can somebody understand the method clearly from what I have written? Have I shown the gap or have I only announced it? And does the whole proposal feel realistic and ethical? If your answers start becoming clear, the proposal becomes stronger. In the next and final video of this first series, we will bring everything together by discussing how to use AI responsibly in proposal writing. That is an important closing episode because by now you understand the structure of a proposal and you can think more intelligently about where AI can support you and where it should not lead. So remember this line from today. Strong proposals feel trustworthy, not just academic. Let us continue in the next video. Welcome back to PG Proposal Blueprint. This is the final video of the first series and it is the right place to discuss AI responsibly when writing proposals. Why now at the end? Because AI should not be the first thing students learn in proposal work. First, you should understand what a proposal is. The topic, aim, objectives, gap, literature search, rationale, methodology, sample size, ethics, and reviewer thinking. Only after that does AI make sense in the right place. That idea is central to the whole design of this series. Your planning notes made it very clear that the strongest approach is not tool first teaching, but research thinking first, then workflow, then careful tool use. Now let us say something very clearly. This video is not against AI. AI can be useful, it can save time, it can help clarify, organize, and support. But it becomes dangerous when students use it before they have done their own thinking. A common wrong pattern looks like this. A student asks AI for a topic, then for objectives, then for a gap, then for references, then for a methodology, and finally submits a document that looks polished but remains intellectually weak. That is not real proposal building. The problem is not only the tool, the problem is the order. If AI enters too early, the student may skip observation, questioning, reading, and judgment. Then the document may sound academic, but the thinking underneath it remains thin. That is exactly what you want to avoid. So, where can AI help safely? AI can help simplify a concept when something feels confusing. It can help organize your notes after you have already read. It can help improve wording when the content is already yours. It can help build checklists so you do not forget important parts. And it can even help you reflect by pointing out weak or unclear areas in your draft. These are useful roles. In your planning material, one of the strongest ideas was to use AI as a support system or even as a critic later, not as the source of research thinking in the beginning. That is a much more mature use of AI. Now let us talk about where AI should not lead. It should not be the authority that claims your research gap for you. It should not generate references that you paste without carefully checking. It should not design the methodology for you before you understand your own question. It should not blindly decide the sample size. And it should not replace your own reading. These are not small issues. These are serious proposal weaknesses. Your planning notes also stressed something important here. The deeper problem in many students is not only AI misuse, it is weak research literacy. So, if the student does not understand the topic well, then even verified AI use can remain unsafe in high judgment areas like gap identification, methods, and statistics. That is why AI should support understanding, not replace it. So, what is the better AI workflow? It is very simple. Think first, read first, decide first, then use AI carefully and verify everything important. That is the relationship you want. In other words, AI should not be your research brain. It should be one helper inside a process that is still guided by your own judgment, your own reading, your guide's support, and the logic of the study itself. If you use AI in that way, it can be helpful. If you use it as a shortcut to avoid thinking, reading, or planning, it will weaken your proposal even when the writing looks good. So, as we close this first series, I want to leave you with one final message. A strong proposal is built through thinking, clarity, logic, ethics, and careful planning. AI may assist that process, but it should not replace those foundations. This first series was designed to help you build that foundation properly. We started with what a proposal really is. Then we moved through topic, aim, objectives, gap, literature search, rationale, methodology, statistics, ethics, and reviewer thinking. And now we close by placing AI in its correct role. So remember this final line. Use AI with discipline, not with dependency. That is the best way to benefit from it without damaging your research thinking. This completes the PG Proposal Blueprint series. Let us continue building from here.